Great. All right. Hi, everyone, and welcome to GHC's WHA, World Health Assembly 76 preview, or what we've been casually calling our WHA 101 discussion. So we are very keenly aware that there is a high amount of interest in World Health Assembly this year. We have been hearing from a lot of our GHC members about their plans or asking questions on how to participate, wanting to know more intel about what's happening at World Health Assembly this year. So we're really excited about the level of excitement, I will say, and hopefully we can use this hour that we have today to do a quick overview of what we know of what's happening in Geneva in May, and share a little bit about how GHC will be engaging and how you as GHC members can engage with us, whether you plan to be there in person in Geneva or if you'll be participating virtually. We'll kind of go through the whole span of ways to engage. So that's the plan for today. For those of you that I don't know, and I think I do know most folks who are joining, my name is Kiki Kalkstein, and I'm Global Health Council's Director of Advocacy and Engagement. I'll be running through part of the presentation, and then my colleague Ansley Moore will be running through the other piece. Questions can be popped in the chat at any time. Like I said at the outset, we did switch it from a webinar format to a regular Zoom meeting. So you should be able to unmute yourself, raise your hand and ask a question too as needed. But we'll also try to pause because we know we're throwing a lot of information your way. All right. So the plan for today. Like I said, we're going to start out with just quick welcome and logistics. WHA76 facts, go through just so you have a sense of the GHC team and the delegation at WHA. We'll be talking about statements. As we know, our members are always interested in contributing to statements that GHC is able to make as a non-state actor in official relations. We'll go over kind of an overview of at least what we've been hearing around unofficial side events taking place in Geneva, talk about GHC's key issue areas where we're tracking things most closely, and we'll be providing updates to our network. We'll overview on communications and what we'll be prepping from our side to help you engage and help us amplify each other's messages. And then we'll have some dedicated time at the end for Q&A. But like I said, if you have questions that are coming up as we're in a specific section, feel free to let us know. There it goes. So hopefully if you're on this call, one, you are a Global Health Council member. If you're not, then, well, we'll talk after. But this call is for Global Health Council member organizations. But if you're not as familiar with GHC, you're a newer member, or maybe you're on staff at an organization and you're not regularly the main touch point with the GHC team, just a little bit of background. GHC is a leading member organization devoted to advancing global health priorities by uniting advocates, implementers, policymakers, and other stakeholders. We now have over 100 member organizations, I think quite a bit over that, but I don't have the exact number. And we're really grateful for the growing diversity of our membership and the range of issue areas that our members care about. GHC members range from small advocacy organizations focused on singular health issues to bigger implementing organizations that receive a variety of different funding from a variety of different donors and implement programs in country. We also have some academia and think tanks as members, as well as private sector members. GHC, in terms of our kind of overall approach, our work is really in these three broad buckets: advocacy, access, and amplification. And the priority of our work is really being a hub for global health organizations to use their collective voice to improve the health and well-being of individuals across the globe. Our advocacy work is bucketed in our kind of US advocacy, which is focused in Washington, DC, on Capitol Hill and with the US administration. And then we have a range of different activities that fall in our kind of global and multilateral advocacy bucket. And one of those big ones is, unsurprisingly, our engagement with the World Health Organization, which includes our participation in WHO governing bodies meetings like the WHO Executive Board and the World Health Assembly annually. Okay, so our WHA team, and hopefully these faces, or at least some of the faces on the screen, are familiar to you. We will have a strong team across GHC that will be helping and engaging and supporting our members in all their different WHA activities and priorities. So everyone is listed here, and you'll find out more as we share about kind of who is leading which different activities. But for now, myself and Ansley are definitely your go-tos in terms of questions, and then we'll direct them across the team as needed. Yeah, that's us. I won't go through everyone, but those are the folks that are here for you. WHA fast facts. Okay, so World Health Assembly, it opens on May 21st, which is a Sunday. So it officially starts on that Sunday, the 21st, usually with just some more ceremonial sessions in that afternoon on the Sunday. And then with real business starting on Monday, the 22nd. Right now it's scheduled to go through at the latest May 30th. The approximate working hours are 9 a.m. to noon with a long lunch break, and then 2:30 to 5:30. So those are the official working hours of the World Health Assembly, of the formal proceedings that will be taking place in the Palais. What we do know is that because of the ongoing construction at the Palais, there are no official side events that will be taking place during this World Health Assembly. So within the Palais, they will have special sessions that are taking place during the lunch hour, as they've done over the past couple of years, on specific topics. I think they call them strategic roundtables, but someone can correct me if I'm wrong. So they will have those happening each day during lunchtime that will be focused on topics either diving more in depth or a little bit differently than how they're being tackled in the formal agenda. We did recently hear from WHO governing bodies that this year, as they did last year, the first time that WHA was fully back in person, that there will be a cap on the number of official delegates allowed for non-state actors in official relations. So that cap this year is 6 delegates, which is, well, it's frustrating for many reasons, and it's also at the same time we understand why. So in the past, for those of you that have been a GHC member for a long time and remember the pre-pandemic days, there was no cap on the number of delegates that non-state actors could bring and have officially badged to enter the Palais for the proceedings. When WHA went virtual, there was also no cap. And then last year, the first time that WHA was hosted kind of fully back in person, they did limit the number of NSA delegates for 2 reasons: because of the ongoing COVID-19 pandemic, and then also because of the ongoing construction at the Palais, and there just being really limited space in the rooms where official proceedings are taking place. So we and GHC's ongoing advocacy around NSA engagement, broader civil society engagement, we do not want this cap and to stick. We again still are continuing our messaging to ensure that it is temporary and is just because of the kind of broader extenuating circumstances given the layout. But right now we have 6 delegate badges. That means for individuals who actually want to enter the Palais and be there to watch the official proceedings and also deliver statements on the floor. All of the broader sessions, as they have done, will always be live streamed, so anyone can tune into those sessions. For the GHC team, we will have a few of the delegate badges for our team, and then the other available badges we will send an interest form out to GHC members who have expressed interest in engaging in WHA, and then specifically for those that are interested in having a badge to enter the Palais, we will ask for a commitment to track specific agenda items really closely to help us, write our summaries and recaps, and also potentially deliver statements on the floor. And we will make those extra badges available through a lottery system, which was the fairest way we could think to do it, for those extra badges. Generally, though, we know that a lot of our members, and from our conversations so far, that most GHC members that are interested in participating in WHA are really going for the wide range of side events that are happening and for engaging in a variety of different activities that are happening outside of the Palais grounds. So we'll talk more about kind of the lay of the land of that sphere of things in terms of side events, and ways that we'll be making information available to you about where and what you can participate in terms of unofficial side events. Okay. All right, so GHC member benefits at WHA. So for our members, there is a whole slew of activities that we pull together around ways that you can engage ahead of WHA, during, and then after. So a few of them listed here for your reference. GHC will host a meeting ahead of WHA with our colleagues at the Department of Health and Human Services Office of Global Affairs. This is usually a nice opportunity for us to get updates from them on their priorities, to ask questions about where the U.S. government is most keenly tracking issues and what they're following and engaging on, and get some other intel and information sharing on resolutions and other relevant happenings at WHA. We also just heard, I think, either earlier today or yesterday, about the world, about HHS's Office of Global Affairs, their official listening session that they host annually ahead of WHA. So we'll share that information as well for folks that want to participate in that listening session, to make an intervention on topics that you're most keenly engaged on, to share your thoughts and opinions with the Office of Global Affairs. But that is separate from the GHC meeting that we'll have with our colleagues over there. The other items that we as the GHC team kind of commit to pulling together for you, our members, is synthesized information around what's happening at WHA. So right now, we're planning to do a bigger kind of information update before, kind of, this is the lay of the land, this is what's going to be happening. We'll provide an update kind of midway through WHA, and then do a full recap update for everyone as well. In the past, we have done daily updates. We aren't planning to do the daily updates from kind of feedback and discussions with members. We thought it would be most useful to have kind of content really focused on before a midway point and then after, rather than the just level of detail that was included in the daily updates. Another way for GHC members to engage is to provide input to GHC's statements that we, as a non-state actor in official relations, can make on the floor during the proceedings. We'll also share social media toolkit and key messages so that GHC and that our members can all amplify each other's messages during WHA. And then we also pull together a full schedule of side events so that you can kind of use that as your reference point on how to kind of build your engagement if you are in Geneva in person, or since a lot of events are happening in a hybrid manner, to see which ones are virtual, so those who aren't in Geneva can still participate in a range of events as well. Okay, I think that is maybe enough for me at this point. And we're going to go over to Ansley, but maybe just a quick pause to see if there are any questions at this stage before we kind of switch gears and go into more detail on some of the content in terms of the agenda items and where GHC has the ability to make statements and where our members can weigh in.
Kiki, we've got a question in the chat about the slides being circulated as our first question.
Yeah, so we will circulate the slides. We are also recording this. So if you have other colleagues who weren't able to join, as long as folks registered for this session, or if they let me know after, we will circulate the recording and the slides to anyone that is interested.
We've also got a question about when the list of side events will be shared. It's still a little bit early. The side events are sort of still coming together, but we will share it as soon as we possibly can. As soon as we have even one event, we can start that Google Sheet, and we'll talk a little bit more about that a little bit further down in the presentation.
Yeah, I think that's right.
What were in the chat.
Okay.
I don't know if there are any other questions before we hop to statements.
Yeah, and I think on the side events, Ansley, you're right. Like, we've heard a lot of ideas and things that folks are generally planning to host, but know that a lot of details are still being solidified. Once we have like a critical mass and first set, I think we can share that, and then we'll just continue to update that same list, so everyone can see as more and more events are being finalized and as we have additional details for those. All right, Ansley, over to you.
Thanks, Kiki. So next we're going to talk a little bit more about statements, which is definitely something that I know I've worked with you all a lot on in the past, and something that's very interesting to members. So as Kiki was saying, GHC is a non-state actor in official relations with WHO, which means that we can submit statements to the WHA official record and then are able to read them on the floor as well. So this includes two types of statements. One is an organizational individual statement, and within the agenda, and we can share the provisional agenda link in the chat in a bit as well, some of those items will be grouped together. So we'll be able to make 1 minute, very short statements, approximately 110 words on those groupings of statements. And the other type of statement is something that the WHO has been doing the last few years, and it's called constituency statements. And it's when multiple non-state actor organizations join together to make one longer statement. So most member state statements are 3 minutes long. It's about 330 words. And so you'll notice the difference between the individual statements, which are shorter, and the constituency statements where NSAs join together, which can be a lot longer. You'll also see on the slide the topics that WHO has already identified for this year's constituency statements. So you'll see UHC about the political declaration on non-communicable diseases and mental health, strengthening WHO preparedness for and response to health emergencies, well-being and health promotion, and social determinants of health. And if you've been tracking the World Health Assembly for the last few years, you'll notice that this list hasn't changed too much. These tend to be the topics and themes that NSAs are really interested in, and so WHO has encouraged NSAs to join together. And there are a few different rules on constituency statements. We're, as an NSA, allowed to join multiple, but we're not allowed to lead on too many. I don't know if there's an exact limit there, Kiki. To know if you want to come in on that, or we can talk about that a bit later.
Yeah. I don't think that there is a limit, but they continue to have like little shifts in the rules around constituency statements, so it's hard to keep up. But just to say from GHC's end, I think right now, and in discussion with some of our other NSA colleagues who we've done these joint statements with in the past, we're likely hoping to lead on a statement on UHC, and then also on pandemic preparedness and health emergencies. But
Thanks,
we don't
Kiki. And
we submit our interest, and then the WHO team, based on the number of NSAs that want to lead a statement, will determine from there.
thanks, Kiki. I think it's also important to note that this constituency statement thing is something that NSAs self-select into. So it's not something that's it's sort of monitored by the WHO, but as far as who we join statements with, that's up to us, and that's not something that the WHO sort of manages from the Secretariat side. So as far as how you all as GHC members can engage with statements, the deadline for expressing interest in contributing to our GHC statements, whether that be individual or constituency statements, will be Friday, April 28th. And we'll send out more information on exactly how you can express your interest after this meeting. And the deadline for input on providing feedback or input into statements will be May 12th. So as Kiki mentioned earlier in the presentation, the assembly starts on May 21st. So this will give us enough time to finalize and submit, and also give our great comms team time to help put together some key messages into our social media toolkit, which will be circulated once those statements are final. It's also important to note that statements have to address particular agenda items and be aligned with GHC's mission, vision, and values. The statements must be read by a GHC delegate from the floor to be a part of the official record. So those who will be in the palais, that will be part of their jobs, is to monitor what's happening on the floor and to read those statements at the appropriate time. And we'll share a bit more about the daily journal a little later on, but you'll be able to check the daily journal that's updated daily by WHA on where things left off the previous day and where the agenda is picking up the following day. Thanks, Kiki. Unless you have anything to add, I think we can move on to the next slide.
Yeah, I think just the last thing to say on the daily journal, because that's a really important point for folks who aren't as familiar with WHA or other kind of UN proceedings, that it is an untimed agenda. So when you see the provisional agenda, you'll see that they have that's very aspirational. So each day they will kind of slot into those time slots, the morning and the afternoon sessions, which agenda items that they hope to tackle during those. But given the ability for member states to make their official statements on the floor, they have kind of regional statements as well, and then non-state actors making their statements. A lot of times things run quite long, so they aren't actually able to tackle the agenda items they want in the time slots. So there is a lot of shifting that happens. There is evening sessions that get announced, usually with short notice, or by the beginning of one day, you'll know that an evening session is going to be happening. But in order to really track specific agenda items, you do have to pay close attention to the daily journal to see when things are coming up, as it may not be exactly as it has been shown in the provisional agenda. And that's the other advantage of everything being live streamed. So even if you aren't, you can kind of check in the live stream and see where things are on the agenda item, or what's happening, because it's not always predictable how long discussion will continue on certain agenda items, and sometimes I think we're caught by surprise that so many member states are commenting and it just goes on for much longer than anticipated, and all of those different factors. Back to you, Ansley.
Thanks, Kiki. I think that was really important to note. So I know we already received a question or two about events. We will be compiling a list of GHC member events. This slide that you see is sort of an example of what it will look like. So there are no official WHA side events this year. There are only unofficial side events, and that reason is due, I think, to the construction in part that's happening in Geneva with the WHO Palais. So we will send around a Google sheet as soon as we start receiving events and learning of events that has the event, the host organization, the date and time, as well as whether it's in person, virtual, or hybrid. So you can start to build your WHA calendar or schedule. We also absolutely want to know if your organization is hosting an event, whether it be in person or virtual. And you can email events@globalhealth.org with the subject heading WHA side event if your organization is hosting an event. And we'll be sure to add it to our GHC events calendar and this a Google Sheet as well that will just be constantly updated as we receive information on more events. We should also say we've definitely received some requests already about you're thinking about maybe putting on a side event at WHA and potentially looking for speakers, particularly with the USG speakers. We're happy to help advise, maybe play matchmaker on that if you are looking for a US government official speaker at your side event. So if you email Kiki and myself about that, we can help you out there as well. Thanks, Kiki. Okay, so these are the key issue areas that we'll be paying attention to while at WHA. So as they progress on the agenda, this is what we're really going to be looking towards. It's probably not surprising, this list here. It's UHC, it's WHO's work in health emergencies, infection prevention and control, as well as WHO's sustainable financing. The sustainable financing item is one that was a bigger item last year. And this year is sort of a follow-up to how the WHO might get sustainable financing. You may have heard about a replenishment model that's been proposed. So we'll be able to learn a little bit more about the discussions around WHO sustainable financing at the World Health Assembly this year. And lastly is non-state actor engagement. This is not on the official agenda, but it's one that, you know, the GHC cares a lot about. Kiki was talking about earlier about, you know, the badges issue. We are tracking NSA engagement with WHO at WHA, but also in other areas really closely. So of course, we're going to keep this on the agenda as key issue areas for us at the World Health Assembly as well. Okay, so this is sort of a bit of a reminder about ways that you can engage, whether you're in Geneva or whether you're tracking WHA virtually. So in Geneva, obviously you can attend unofficial side events, side meetings like Kiki was saying earlier, setting up meetings with WHO colleagues or member state delegate colleagues. As well as monitoring member state negotiations and making statements on the floor. Again, this is only possible with an NSA badge for you to get into the Palais. But virtually, you can also contribute to our official statements and constituency statements. Obviously, a lot of this work will happen over the next few weeks into mid-May, given our deadlines internally. Also, we would absolutely appreciate you amplifying our GHC statements, key messages, and events on social media, which you will be a part of creating. And another way is tracking official proceedings via the live stream. I don't recommend this if you're on the East Coast getting up super early, but it's also definitely an option. And then obviously there'll be a ton of virtual side events as well to attend.
And Ansley, if I can just hop in with one other detail. So on for those GHC members that are planning to be in Geneva, like Ansley said, there'll be all the different unofficial side events. And then for our GHC members, we're also planning a networking event for folks to be able to meet and interact with each other there. So keep your eye out for more details on that. But for folks who plan to be on the ground in Geneva, we will hopefully find a lot of ways to connect and be together in person. But specifically, we'll have a GHC broader kind of networking reception. So more on that soon.
Thanks, Kiki. And we're almost through our slideshow, and I know you all probably have a lot of questions. So just to let you know, we're almost through. On the communication side, like we mentioned, we'll be sharing social media content and key messages in the days leading up to, during, and following the WHA. And we will be circulating a social media toolkit, which will include messages around statements and key issue areas for GHC by Wednesday, May 17th. So using the hashtag WHA76, tagging @globalhealth.org, and any other partners and delegates is definitely appreciated. And you will have more information from us once May hits and we have our statements, and social media, like I said, will be created from those statements and key messages. And our last slide is really just a summary slide. It has the link to the daily journal. We'll circulate the PowerPoint ahead of the social media toolkit being ready, but you'll have that when it's ready as well. You can find more information about how GHC engages with the World Health Assembly on our website. And you'll also see a link to the events calendar again. So the events will be there as well as in that shared Google Doc as well. And yes, like Kiki said, that daily journal link is going to be your best friend if you're tracking things really closely. That first one up in the top left-hand corner will help you really navigate what's happening that day, where things left off, and where they think things are heading the next day. Like Kiki said, it's very uncertain and it changes daily.
Yeah, and those evening sessions are killer. All right, I think, yep, Ansley, that's everything. So I'm going to stop sharing so that I can see folks. I'm seeing the chat numbers tick up, so I imagine we have more questions.
We do have a few more questions.
Okay, great. All right, now I can see everything. It's really hard to share screen and track what's happening in the chat, but thanks everyone for bearing with us. Okay. Going back up, there's lots happening in the chat here. I saw a couple of questions. One that was our colleague, or comments to our colleagues from Women in Global Health, sharing about, what their delegation will look like and the issues that they're following most closely. So thanks, Becca and Susan from Women in Global Health. And then let's see, Lauren asked about ECOSOC status. So someone else can definitely chime in on this, but ECOSOC status is just for engagement in other UN meetings, especially those in New York. The non-state actor status with WHO is a different designation, and there's a whole process for getting approved as a NSA in official relations with WHO. I know like Women in Global Health recently went through that process and became an NSA, and there are a number of other GHC members who have NSA status from their individual organizations. But many GHC members obviously participate in WHA through their membership of GHC. ECOSOC status is separate. Okay. Oops. I lost the chat again.
The other question was on contributing to GHC statements.
Let's see. Oh, the process. Great question from Sabina about the process to contributing to GHC statements. So we are always welcome. We always welcome feedback on what is the easiest way for folks to contribute, because we've tried to streamline it as much as possible. But as always, when you have multiple sets of hands weighing in and, wordsmithing and commenting, it can get messy. But generally what we will do is, as Ansley mentioned, we will kind of put a call out for who's interested in either leading on a statement or contributing to statements on specific agenda items. And then everything will happen through Google Docs. So we'll have a shared Google Doc based on each individual agenda item that we plan to make a statement on. That Google Doc will list, who the lead drafter is, anyone else who is wanting to contribute to that statement. It will give you the kind of parameters for the statement. So if it's an individual one, 110 words, that's a minute that individual statements get to be read on the floor, or 330 words for constituency statements. And then the lead drafter will take the first stab at putting pen to paper. And then anyone else who wanted to contribute will be able to go in and, make suggestions in suggesting mode, or make comments about other things they want to include and go through that. So we'll have, hopefully, and be able to stick to a tight timeline there. The one factor on timeline is that a lot of times we're waiting for the actual document, the official document that is being reflected on for that agenda item. We're waiting for that to be posted to the WHA documents page. So we can have the most of the content of a statement, but sometimes those documents aren't posted until like really close to the actual opening of WHA. Some of them are already up there, and they're there and ready to be read and reflected on, and then incorporated into statements, but some do not get posted till much later. You don't have to worry about individually emailing us at this point. We will send out a whole call for interest in statements, and you'll have a way to sign up that way to express which agenda items or topic areas that you want to contribute to statements on. So hopefully that answers that.
We've got another question about collecting
events,
information on who's planning to attend from GHC membership, which is something we did last year and we'll definitely do again.
Yeah. So we will, for GHC members, I mean, we want to know who's going to be there. So in that kind of same like broader, we'll send out likely just a Google form, and you can express interest in statements, and then also let us know if you're planning to be there in person. And then we will kind of have a full list of GHC members who will be there. So you'll know who's there if you want to set up one-on-one side meetings with other GHC members, or like I said, you'll have the opportunity at side events or the GHC networking event to meet other GHC members that are participating in person. Let's see, I think we covered most of what has been in the chat in terms of questions. Any other questions, reflections? Oh, Susan from Women in Global Health, go ahead.
Hi, thanks. So this one's a bit out of the box for you.
Oh, good. Can't wait.
But I reckon you're up for it. So we, as I put in the chat there, we do have a delegation of women in global health coming to World Health Assembly. But because we're limited to 6 passes, we need to find a place to get together each day, to plan our tactics, to convince the member states to be prioritizing the gender dimensions of health, for example. Do you have a working space that you'll be using, or is there some kind of CSO space whereby you can colonize it for a bit of a hangout space?
Oh, I love the idea of that.
Wouldn't it be cool? We need a CSO hangout space.
A CSO, Courtney from Task Force is laughing. Yeah. So that would be really great. And actually now, Susan, you gave me the idea that we should write to WHO governing bodies and see if there is an availability of any kind of working space.
That's a good idea.
Yeah, I
Tedros
think
should give us a room. Like if we can't get into the Palais,
yeah,
there
give
should
us another
be a
space
room
to convene.
Yeah.
I mean, in terms of things that are very close to the Palais, I mean, ICRC is right across the street, and their kind of cafeteria area is open and open to for folks to kind of convene. It wouldn't really be like a working space where you could hunker down for the day in any way. But I do know that's kind of the closest, easiest place of access I can think of to have, a little discussion that's right there. But there isn't anywhere else. There's no designated space, but that's a great reflection. And I think, WHO, or for official member state delegations, they get like a delegates room that they get to convene in, but I think, limited space and just given like what priority NSAs get, we don't have any kind of official convening space. In WHO HQ, I think someone just put in the chat, there may be spaces there or rooms there that could be used. But just to note, I mean, given the kind of layout and of Geneva, WHO HQ is a bit of a ways from the Palais where things are happening, but there may be it may be another option to have a meeting or convening space within WHO HQ. Any other ideas? Maybe G2H, yeah. Other ideas in the chat are really
It would be good. I'm just thinking,
I appreciate it. No, it's a good question, Susan.
If IFRC could be persuaded as a common good to allocate a big room for civil society for the week, that would be an incredible support to all of us. And it would mean that we can include a lot more of the people who are coming in the action, because it's already difficult enough to get visas for people from lots of different countries. But then if they come and you have limited badge numbers, then what are you doing? You're sort of saying, well, could you go to this side event or that side event? They're not necessarily familiar with Geneva or how things work, and they don't get the vibe of all of us working towards these purposes that we have there. So if it's a huge plea.
Yeah, no, it's a great idea. Let's follow up, Susan, offline, and we can both maybe put out a few different feelers and asks and strategize a little more. And anyone else who has ideas, let us know, and we'll see what we can figure out. Any other questions, comments, hopes, dreams, concerns? All right. If everyone got their questions out in the chat, yeah, we're really happy to provide this overview and glad that it was useful to folks. Like we said earlier, we will share the full PowerPoint as well as so we'll share the full PowerPoint as well as the recording with all of you, and then there will be, the information exactly with the timeline on statements, way to express interest, all the details on how to submit your side events so that we can include those in our side event tracker. And then we'll be asking for more information on who will be there, so to keep an eye out for or connect with other GHC member colleagues and friends. Anything else, Ansley, or anyone else on the GHC team who is on the line? Did we cover it all? I hope.
Yeah, thanks everyone for joining. I think if you have any remaining questions that you come across in the next few days, please reach out to Kiki and myself, and we're happy to help find answers if we don't know them.
Yes.
Jen's asking about a WhatsApp group.
Yes.
Yeah.
We definitely will do a WhatsApp group for those that we know are in person in Geneva, just for information sharing. I mean, if someone's like in the room tracking certain agenda items and letting everyone know what's happening when, we'll definitely plan to have a WhatsApp group for those in person. Great. Well, I think we will call it there then, and just say a big thanks to everyone for your excitement and engagement and your really good questions. And you will hear more from us very soon. Thanks, folks.
Thanks.